Hello, Livingston, and welcome to our ongoing series of live programs here in Livingston Education. I'm Mike Raymer, and we have a special program today, the second of a three-part series on mental health, anxiety and stress in children and teens. And welcome to our panelists, mental health professionals, Amy Roeder, a licensed professional counselor, Priscilla Bauer, a licensed clinical social worker, and Julia Farrell, a licensed associate counselor. Amy, Priscilla, and Julia, thanks so much for being with us. How are you doing today?
Doing well.
Thank you so much.
Fantastic, great to have you all. For all watching, please comment and ask questions in the live stream, and we'll answer in a Q&A toward the end of the program. So let's begin with each of the panelists giving a brief background of themselves. Amy, would you like to start us off, please?
Sure. So I'm Amy Roeder. I am a Livingston mom. I used to work at Livingston High School. I was an English teacher, and then I moved into the in-school suspension room, and I was the anti-bullying specialist. And then since then, I've gotten my master's in mental health counseling. I'm a licensed professional counselor, and I work in private practice with clients who have anxiety, disordered eating, depression, and others. I mean, the list can go on, but yes, that's where I specialize.
Fantastic, Amy. Thank you. Priscilla, tell us about yourself.
Yep, I have about 10 years of experience working as a therapist. I've worked different levels of care. Definitely got my start working on acute crisis with ER and inpatient psychiatric, mostly with children and adolescents, and then eventually transitioned into a private practice. And I'm currently the clinical director at Short Hills Counseling. Most of the approaches or techniques that I use are related to cognitive behavioral therapy, which is short for CBT. And that's kind of what I do on an everyday basis.
Great, thank you. And Julia.
Hi, my name is Julia Farrell. I'm a licensed associate counselor. I've been working in the field for about 2 years now, working with a multitude of different populations and levels of care. Before doing outpatient, I was working at Gen Psych, which is at a partial level of care and for the more high-risk clientele. And I specialize there doing dialectical behavioral therapy.
Great, thank you, Julia. So Amy, you have some slides that you prepared to help us frame the discussion, yes?
We do. Here we go. So this is not a formal presentation. So if at any point, Mike, you have any questions or questions pop up on your screen, it's fine to interrupt us. This is really more of a guidance to make sure that we kind of touched on what we thought would be questions that the population might be interested in knowing. So it's really more of a guidance for us. So the first thing that we wanted to cover was the difference between stress and anxiety. So stress is usually there's something causing it. There's like an outside stressor. So you get stressed from work or you get stressed from school. There's an outside, thing that's creating that emotion in you. And when we take care of the thing, that emotion, that stress goes away. So if you deal with your studying for a test, then the stress about the test goes away afterwards. Anxiety is more parasitic. So it's more like you just have this emotion of worry and you don't actually need to have a definite cause. And when you deal with the one cause, if there is one, it can kind of hop over into another direction. So it's more of like an emotional state of being rather than a reaction to what's happening in your life.
I think a good additional descriptor, and when we're talking about cognitive behavioral therapy, is we often we find the link between thoughts, feelings, and behaviors. And so what we find is that oftentimes it's our thinking or our negative core beliefs that we have, like I'm not good enough, or might I be rejected, or might people think a certain way about me? And then those lead to us having anxiety or even any other emotion that we might have that's a negative or positive. And then we may have a behavior such as like avoidance. That's a huge anxiety related behavior. So you often see avoidance. So that would be a good descriptor of how that anxiety might transpire.
Very good. Julia, you have anything to add? Amy was saying stress, Amy, you were saying is an emotional, it's from an outside force, yeah? Anxiety, let me ask you all, and Julia, please. I think of as anxiety an illness or a disorder. as compared to stress? Talk to us a
So
bit
how I
about
can
that.
jump into this
Sure.
is, so it's an emotion, we have a million emotions that we kind of experience, but to have anxiety as a disorder, it means that you have to meet criteria. Oftentimes a big piece of that criteria for the diagnostic statistical manual, which is what allows us to diagnose, is it impacting daily function? So meaning, is that person avoiding school? Are they maybe not getting out of bed? Are they avoiding social interactions? Things like that. This is specifically related to anxiety. There's also various different types of anxiety disorders. I think maybe Julia or Amy might want to comment on that a little bit more. Thoughts,
Yeah,
yeah.
so I think, for this, presentation, we're more talking about generalized anxiety disorder. But there are a lot of other diagnoses that fall underneath it. So there's PTSD, there is social anxiety, there's OCD. And so those all fall under, generalized anxiety or, anxiety disorders as a whole. And I think, everyone can understand what it's like to experience anxiety at some degree, but then it does cross over a threshold where it's like, how is my life not manageable, or how am I, how is this impacting my daily functioning? And that's where it becomes problematic.
So there's different types of stress and anxieties. And of course, this focusing here on children and teens. So for example, and I think Julia, you mentioned a number of them, there's academic anxiety, yeah, social anxiety. What other types of anxieties might children experience?
There's separation anxiety. So leaving, primary caregiver. You said academic anxiety, more specifically test anxiety.
Okay.
So like you're worrying about the test, but then you're worrying so much about the test that you're doing worse on the test, or you can't even get yourself to that's where it would show up academically.
There's also like specific phobias, I think is a big one. And then also maybe like panic attacks. And so that also falls under anxiety.
Mm-hmm. And so that's a good summary of anxieties. And again, stresses. I've read and I've heard there's good stress and bad stress. Yes, I would think for adults and children and teens. And could you talk to that a bit? What are some of the good stresses and maybe not so good stresses?
I would say applying to college is a good stress, but it can also be a bad stress because there's a lot of work and effort, and then kids deal with the uncertainty of, am I going to get in? I think for adults it's the same thing with job interviews, so I think there's like an overlap there. And then it's once you get the job or once you get into the school, then there becomes the anxiety of, am I good enough? I think there's this concept of imposter syndrome where oftentimes people work so hard at earning something that once they're there, they're like, I don't know if I deserve this. And so I think that you see a lot of that. I think some of the other anxieties, I see with little kids is like a nighttime anxiety. They think something bad's going to happen to them, even though their parent is there or whatever. And so they don't want to go to bed, or they're avoiding bedtime, or they want their parent to sleep in the same bedroom as them. Different things like that is some of the ways that I see it manifest.
Right.
Yeah, I think that just to hop on that, like a good stress, we have stressors in our life, like a deadline perpetuates us forward, right? So that's a good stress. We've met some goals in our life because of stress, because of deadlines, because of requirements, because we are just getting up to the point where we have no more time to work. And that forces us to complete things. So that would be a good stress. It's when it becomes so big that the mountain is so large that we freeze or we run away from it, then that's where it starts to fold in on itself and it's no longer helpful.
Right. Makes sense. I have thought about and have read, makes sense. Adrenaline, right? That's the body reacting to forces to raise. You could all talk to this better than I could. But getting you hyper aware of good things. I would think, for example, prior to an exam, right? Adrenaline flows and perhaps can help with performance. I don't know. Yes, good stress.
I think there's definitely some research articles actually commenting on that, and it does help with the performance sometimes. I think it's about the balance of where you're thrown over the edge, where then you freeze. As long as you're not being thrown over the edge where you have that flight response, then yeah, it does help performance.
Right.
Talking about bad stress a little bit more, we do know that stress does increase cortisol levels. And so we do know that in that increase in cortisol levels, if it stays at a heightened state like that, it can also, create challenges with medical issues, because when our cortisol levels are high, our body doesn't heal as well and things like that, which can exacerbate, physical symptoms.
And focusing on children and teens, when can stress and anxiety show up in children? As early as what age?
I can jump
in
in.
terms of
Okay, go ahead, Amy.
in terms of a diagnosis, I mean, which is a little bit different, I think that anxiety and stress can show up. You can have stress in the womb, in terms I think that depends on a lot of different factors. We know that there are definitely environmental factors that exacerbate stress or anxiety, as there are biological factors. So I definitely have clients that tell me that have a panic attack or an anxiety attack, and they're like, but nothing was going on. And it was really, there's a chemical component or a genetic component to it, where it's not, again, when we're talking about the difference between stress and anxiety, it's not coming from something outside, it's something internal. I think because of the stigma of talking about mental health, like we know our history medically, like if our parents had if our mother had breast cancer, we know that, right? But if we talk about even just the generation before our generation, there's a lot of undiagnosed mental health. So it's harder to understand or to really know what biologically is being passed on, because there are plenty, as we learn more, you're like, oh yeah, my grandmother probably, but like it was never diagnosed. So bringing down that stigma is really important, so we can have a more accurate line and a more open conversation about it.
Makes sense. Do you all have patients, children that are as early as 4, 5, 6 years old?
So yeah, I definitely see 5-year-olds. Generally, if we're doing treatment for a kid that young, I do attempt to do a very limited short-term therapy to kind of give them some skills. Verbalization at that age is a little bit more challenging, so it is very skills-based, because they're not really fully understanding their emotions yet. They haven't really reached abstract thought yet. There is this concept called law of conservation. Just to give the audience a little bit more understanding as to what law of conservation is. If you were to give a kid a choice of 2 cupcakes and their exact same cupcake on 2 different plates, and then you cut one in half, but it's still the exact same cupcake other than it's cut in half, you ask a 5-year-old which one do they want, they're going to say they want the one with the 2 pieces. And if you ask them why, they're going to say it's more. Now, myself and you know that it's not more, but they think it is. So kind of understanding that concept that they don't really have abstract thought yet. Any kind of interventions with children are going to be very time limited generally when they're that young, up until about the age of 7, then it can be a more, expanded upon. And it's some type of behavioral intervention, whether it's like breathing techniques, maybe it's like them doing some exposure therapy kind of work, where they're exposing themselves to that stimuli so that they can practice and become an expert at it. And it might be with some behavioral intervention, like a token-based system where they're getting rewarded for exposing themselves. That's kind of what I see with the younger ones. I actually personally try not to bring in a kid under the age of 5. I have seen them, and I will only do that if they're maybe at risk of being expelled from school, or there's some extenuating circumstance where they really, really need that treatment at such a young age. So that's my approach. What do you guys think?
Very good.
Yeah.
Amy, I'm not sure if your future slides will get into this topic, but what causes stress and anxiety, different category? Is that for future slides you have, or on this topic here?
We do a little bit about our the Livingston environment a little bit, but just to piggyback off of what Priscilla said a little bit, I think it's important, this is really important for parents to know, because I think I've had examples where parents have brought in children who have anxiety. They do have anxiety. You can't really do cognitive behavioral therapy, like where it's like talk therapy and understanding their thoughts at that age. So the interventions are behavioral, which can seem like sometimes parents are off put by it, but that is the way that, exposure, if you're afraid of something, doing the thing is what actually teaches your brain that it's not dangerous. So that's where the behavioral piece and the exposure piece comes in. So sometimes parents are, want to kind of talk through their feelings, and a 5-year-old generally doesn't have that abstract thought to be able to do that.
Sure.
But yes, the environment, I'm gonna go to the next slide, Mike. So what are the major elements that increase anxiety and stress in an affluent, academically competitive environment? So I know we're painting a broad stroke. It's not everybody is like, our environment is affluent. So I want to talk about that too. Like we are definitely in a town where this is part of the culture that we're living in, and how does that add stress to individuals who are there, specifically our kids and our teens? Because it's different depending on where you are, right? So that academically competitive environment, I think, is really important to touch upon, because and affluent, when you're in an affluent, academically competitive environment, there is this kind of like bottomless bucket. Like it's a culture of, if you can, then you should. And the more you do, the more you should do, and push and push and push. Like even when we talk about like academics, getting into college, that kind of stuff, it's not just what grades did you get, it's what grades did you get, where did you volunteer, what sports were you on, what clubs did you had, like it's all of these things. And that kind of real like go, 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 just do the best. If you can take this honors class or the AP class, then you should. If you got recommended, that kind of thing, you can get really swept up in that, and that can cause a lot of stress. And then your perception of yourself can also get lost in what you're doing and not who you are. So we have like a whole bunch of stuff that kind of comes from the culture that we are living in, that it's really important for parents and for our school to be aware of as they're guiding students through this kind of academic rigor. Yeah, I stopped on but that's basically something to just be aware of. And just that my son is going into the high school next year, I do want to give a shout out to the guidance department. When he was getting, at least from our guidance counselor, when he was getting kind of brought through the when I was on the presentation about scheduling for next year, she stressed balance over and over and over again. So it was like, even if you can take honors straight across, maybe that's not the best way to enter into the high school. Maybe, kind of feel your way through it, like really think about things. So we are trying to move against that a little bit, but that causes stress and anxiety in parents who are like, if they don't do this, then what's going to happen? Are they not going to get into college? Like, that's they're having a response to it too. So I don't know, you guys, do you have anything else that you're seeing?
So one thing that I think is kind of interesting, I learned this when one of my professors told me this when I was learning about anxiety and diagnosing, and it's always stuck with me, is she said that anxiety is highly contagious. And I've never thought about anxiety like that because we don't think of it as like an infectious disease. However, anxiety does breed anxiety. And so when we have a community that's very high achieving, or who, there is this anxiety, it starts to, have other people who may not experience anxiety start to pick up on it. And I'm sure we have, at least for me, like if I've ever taken an exam and I'm well prepared and studied for, and I go into the exam room and everyone else is stressed or anxious, I start to doubt myself, right? And so I start to pick up on that anxiety. And so it's really important, I think, if children are experiencing this anxiety, something that's really great that parents can do is to be very grounded and stable, and not to kind of circle in, or not like kind of go into the anxiety as well, right? Like not feed into it in a way, or get anxious and then kind of, because then it just becomes an ongoing cycle. And so I think that's one thing we can see in a community, is that it starts to breed so much anxiety, even if children have never experienced it before.
I think it's natural, like parents, right, where we become parents, and there's like this biological instinct to protect your kids. So like when they're little, if they fall, you pick them up, you give them a kiss, you put a Band-Aid on, and then they're fixed. And then when they get older, or anxiety, which is something that you can't just fix, like it's natural for parents to like feel that and to take that on and start to panic. And that's why also part of the work that we do, sometimes we recommend that parents get their own therapist and get somebody to talk to kind of learn those skills too, or we do it as well, where we'll like on the side be also coaching parents for how to be, because it is not only is it like Julia said, like in and of itself, when you're not connected with somebody. I know I've had experiences where someone's talking and I'm like, I gotta go, they're so anxious, I'm like I can't even have this conversation. But parents specifically are so like their instinct is to protect their kids, but what they're doing is like almost the opposite. It can increase the anxiety instead of help ground them.
Yeah, I can actually just give an example of that. So, in working with some teenagers specifically, I see that, parents might see their children have anxiety, and so they want to respond every time that their kid is expressing that anxiety, but their kid then starts to expect their parent to fix the anxiety. And so then it almost takes away the ability of that child to self-soothe. And then they become reliant on just someone else telling them how to feel and everything like that. And then what happens is the minute that person's not there, they don't know how to self-soothe. So I see this kind of really play out where I have some children texting their parents throughout the school day, I'm feeling so anxious. But then what happens is this text chain goes on for like hours and hours. And what's actually happened is where a parent was hoping to get their child to feel better by responding. Actually, what happened is the child just kept stewing and ruminating in that anxiety, and it grew and grew and grew it. Whereas sometimes I actually have to coach a parent to say, you know what? Don't respond to them right away. Respond at like 2-3 hours later and just say, oh, I'm sorry you're having a tough day. Give them like a technique and then go missing a little bit again. And what you're actually allowing your child to do at that point in time is actually sit through some anxiety and learn how to deal with that. And I know that's really hard for parents. And when I tell parents, sometimes they look at me like, what is she talking about? But because otherwise they're not learning how to soothe themselves. So.
And I think an important thing, like going off of what Priscilla's saying, is you can definitely validate, you don't want to diminish, their anxiety or what's going on. So you want to validate it. However, you're also going to be very stable and you're going to be able to, give them a skill that they can self-soothe on their own.
Very good. Thank you. Amy, you have your next slide. Yes.
Sure. How does social media and internet use impact anxiety? So definitely a relevant topic, not only with just the year that we're in, but I also coming out of the couple of years that we were just in. We've definitely, I know I've definitely seen an increase. We'll talk about it a little bit more in the next slide when it comes to COVID. Social media and internet. Okay, so my perspective on it is this. Social media and internet are not in and of itself evil things. This is kind of where I'm coming from. There are parts of social media and internet that can be helpful and coping skills for some people, right? It's when it's being used, depending on what is coming up in your feed or what you're looking for and what kind of algorithm you got pulled into, those things can make it where it's more harmful than helpful. So the example that I give is like, if you go on my Instagram, I just have videos of puppies and pandas. Like that is my scroll, and like a couple of comedians. And to me, a couple of minutes of going on that can actually make me feel better, and it can be used as a tool. But I have clients who have on their feed, like, I don't know, really thin models talking about what they ate every day. That's not going to be helpful. Like that's going to pull you into a mindset. So, we are essentially what we think. So if you are getting pulled into a specific mindset over and over and over again, that is not a helpful one, then your brain starts to filter out the other things and you start to hyper focus on stuff. And if it's disordered thinking or unhelpful or unhealthy thinking, then social media and internet can exacerbate that.
There's a scientific term for it. That filter that she's referring to is also, it's called the reticular activating system. So if the audience did want to Google a little bit about that, you can. So there's actually a center in the brain that kind of controls that filter. And we have to have that. Otherwise, we would be overloaded with too much. Like if any of the audience has ever watched has anybody ever looked at a Facebook page, there's so much data on that page. How does our brain know what to choose out? And so our brain is filtering, even in that moment, I'm going to look at this. So if your brain is focusing on these negative things, or if it's focusing on certain areas, it is going to naturally start developing a negative bias or a negative base if that's where the focus is.
Yeah, I mean, it's really interesting. I feel like we aren't designed, or our brains aren't designed to be connected to so many people. And so it's like we're being told that we have to like be in touch with everyone at all times and, always be up to date with everything. And so I think that something with social media, how Amy was saying, it can be very helpful if you set boundaries with it. And if you make sure that you are maybe muting or unfollowing pages that, don't necessarily serve you, I guess, or like will provoke more anxiety, and really starting to focus on following pages or accounts that do make you feel better, so you can utilize it as a coping skill.
A lot of times in my practice, I talk about like, it's not so much what you're doing, but like why you're doing it and how you feel. I mean, there are definitely limits to that, but like when it comes to this specifically, like and kids can't always do this on their own, which is where kind of parents come in. But essentially we want to get to a space where like you watch a show or you go on the internet, and then afterwards you assess like, am I feeling good when I do this, or am I not feeling good when I do this? And if you're not feeling good, then that might be a time to like take a break from it, or look at something else, or like Julia said, like cut things out of your feed, or like there's so many different things that you can do if you're in tune with like, how do I feel after I do this thing? Is this actually serving me? Is this making me is this pushing me into a space of wellness, or is it pushing me into a space of sadness or anxiety or worry?
I know that this isn't necessarily social media or internet, but I'm just kind of thinking about the news and how everything's portrayed as, it's almost like anxiety provoking, right? It's like breaking news. And it's almost like you always have to be watching the news, or you're not going to be up to date with the latest, information. And so just sometimes how, information or media is being brought to us is in an anxiety provoking way.
Yeah, and putting in those limits, right? So we get pulled, like if you're not on top of everything, then there's something wrong. But the truth is that, or not the truth is, but if you're realizing that that's not serving you to like watch that all the time, then putting in some limits can benefit your actual experience in life.
Yeah, no, because I remember when, COVID first happened in March 2020, I was like glued to the news and making sure I had all the, all of the information. But I started to realize how much anxiety that started to cause. And so I had to put those stoppers in, where like, okay, I would start my morning, and then mid-afternoon, I would watch the news, and then maybe like a few hours before going to bed, to make sure I was still in the know and had like relevant information. But I wasn't constantly feeling the need that I like every single, information that came out, I needed to have.
This is fantastic discussion. Thanks so much for covering these topics. For all listening and watching, please comment in the live stream, and our panelists will answer in a Q&A toward the end of the program. So your next slide, Amy, what do you have for that? Big topic.
How did COVID? Okay, so I guess the short answer is we also do not know yet. Like we're still figuring out really what's happening. If you think about like when your kid gets hurt, you go into kind of this mode of where you're just kind of dealing with the thing that's in front of you. And then afterwards, when you find out that your kid is actually okay, then you fall apart as a parent. We are doing this also as a world, that's happening too. But to kind of break down like COVID and what we've experienced so far, there's so much to peel through, but I will say that people who had social anxiety like loved COVID in the beginning, didn't love COVID, but loved the isolation in the beginning. It was like, yes, I don't have to go to school anymore, I don't have to see anybody, I don't have to talk to anybody, super happy. But like we
wanted
said
to stay at
before,
home even when some kids were going back to school. They wanted to stay
100%.
remote. Yeah. Mhm.
100%. However, what also happened is because, you know, when you have anxiety, as we said before, one of the things that actually brings anxiety down is that exposure. So if your anxiety, what you want is anxiety, not what you want, but like the easiest to treat is anxiety. That's something that you actually have to do every day, ironically, because you get more and more exposure and then the anxiety goes down. So if your anxiety is like going on a plane and you don't like fly all over the world all the time, it's going to get harder. It's harder to actually get through that anxiety because you're not getting exposed to it often. So there's enough time for all those fears to kind of build back up before you actually get back on that plane. But if your anxiety is around going to school, if you get the practice of going over and over again is actually the thing that's going to bring it down, as opposed to the avoidance of it. So that feeling of anxiety shot down when there was the remote school, but then it made it on some level for some kids a lot harder to actually get back into the swing of things when school picked up. Or for some, I don't know if you guys saw this too, some of my clients who have more social anxiety, they got the isolation just enough to the point where they're like, oh, I don't want this anymore. And actually we're happy to go back to school, which was a really interesting, like getting that break for as long as it, like almost that forced isolation for that extent of time. When schools opened back up in September, some of my clients just like felt better. Like they were some of my clients that did have some social anxiety prior, like going back, all of a sudden they saw the benefits of being around people and wanted to be there. So that's part of it.
I think
Go ahead,
another
Priscilla.
thing
Yeah.
I'm more recently experiencing now that the mask mandates have been lifted in some of the schools is I have some of my kids with social anxiety who are afraid of being rejected and kind of the fear of judgment and everything like that, who are continuing to wear masks, not because of fear of germs or getting COVID, but more because they don't want to be seen by their peers. And so it's interesting because I wouldn't have seen that dynamic and I've never seen that before because we've not worn masks, in the office and things like that before COVID occurred. So it is interesting that kids are experiencing new kind of things that are popping up that I would have never even thought as a clinician.
Yeah, there's a protection. I'm seeing that too, Priscilla. Like there's like even if it's not like as out in the open of like, you're going to see my face, there's something protective about having the mask. Yeah, and we're seeing that with some of them. And then there's just the side of like, we had a global pandemic. So aside from the isolation, there's just, which I think, I don't know what you guys saw, but well, for little ones to keep their masks on, some parents had to kind of like had to like explain to them that they could get sick if they took the masks off, right? And they had to kind of, I don't want to say scare them into, I don't know if that's the right way to say it, but they did essentially have to express how important it was. And that caused just the like grappling of like that, trying to deal with when you're that young, the fact that like being around people means that people can die, cause a lot of anxiety with children. And
I think with kids, we
teens.
often simplify, right? So we're just going to say, oh, you're going to get sick if you don't wear it. Like we can't explain, like they're not going to fully understand everything about the 6 feet if you got a little one. And so you often give limited details. So when there's not many details there, then when you're trying to then get them to take their mask off, I mean, obviously, every family's different, but if that was the case, it becomes more challenging because you just explain it in such simple terms to them when they had to wear it, right? So then why not all of a sudden we don't have to wear it because germs still exist, right? So it can be a little confusing to the littler ones. Absolutely.
Another thing that I'm seeing is that because everyone was the family unit couldn't separate at all, that there's more separation anxiety now. Like where, I don't know, going, like even parents like going out for a night. There's a heightened anxiety because kids are used to their parents being in the house at all times. Everyone was working from home. Nobody went anywhere. So when they, maybe developmentally should be more used to parents like leaving and going out for a night or doing something, like there's a heightened level of anxiety with that as well.
Very informative and enlightening. Thank you all. Amy, what's your next slide?
What are things that parents can or cannot control? So we mentioned a couple of things earlier, but I do want to say I always use the image that like are sometimes like often our instincts around getting anxiety to go down are the opposite of what we should be doing. So I like the image I give people, like my clients, is it's like having a headache and banging your head against the wall to get rid of it. Like it's almost a lot of things that we try to do makes it worse. So when Priscilla gave the example of like a somebody who's texting home and talking to their mom, like, I'm so anxious, I'm so anxious, I'm so anxious. A lot of times when kids are anxious, they go to their parents, they say that they're anxious, and their parents are like, about what? Tell me everything, you know? And when if you've ever even been not anxious, like say you normally get anxious on plane rides, right? I gave that example before. You could be not anxious on a plane, and somebody who's used to you being anxious is like, oh my God, you're not anxious. And then you start thinking, am I anxious? What did it feel like when I was anxious? And the next thing you know, you're in a panic attack. So talking about it, especially when you're already in the heightened state, actually increases it more likely than decreases it. What we really need are tools that will we're going to give you a few of them in the presentation, but tools that actually bring you down to a certain state. And it's not until you're really kind of calm and separated from it that you can look back and you know, figure out how to get the exposure to it and then plan for the next time. But in the middle of it is not the time to be like, tell me all the stuff that's making you anxious and let's dig into it and figure out what's going on. That actually increases it, not decreases.
And just reinforcing for a parent, like even in session, if I was sitting across from someone who's having a panic attack, I'm not going to say, okay, tell me more, because that's not going to work in that moment. It's only going to make it worse. Any kind of words really make it worse. I feel like the only thing I've ever been able to really do and gold standard are breathing techniques. That's going to really help that panic attack come down. Or there's something called a grounding technique, which is 5, 4, 3, 2, 1. And that's really the gold standard as to what helps get those anxiety panic attacks down. So if that's what the clinicians are doing, that's definitely what the parents want to be doing.
Right. Same thing. Like we sometimes have clients who are like texting us in a panic attack, and we're giving them de-escalation techniques. We're not jumping into the ins and outs of whatever is worrying them for the day. Like we're getting them to a place of stability and then helping them just move. Then it's just move on with your day. And then when you're in the office with us, we can reflect and go back to it. But like, it's about moving forward, not sticking in and doing the cycle of what's happening, because it's going to make it worse. What can parents not control? So I think that a little bit is that kids are, you know, I have a lot of parents who talk to me and say, you know, we are not a household that stresses like what grades you have and what school you need to go to, and you need to do all these sports. And meanwhile, our kids are coming home and they're saying, I have to get A's, or they're kind of getting wrapped up in it. This is where we talk about just like the environment, you know, or even if you say to your kids, like if you're very strict on like screen time or what they're watching, like they could still go to school and talk to somebody who watches that. It's like when I was younger, it was like the kid who couldn't have any junk food in their house and they would just go to the other kid's house and have junk food there. Like, so it's not so much about trying to, yes, you can absolutely have limits, and you should, on, you know, knowing your kid. If your kid needs limits, you should have limits, which most kids do need that. However, it's more about giving your kids the tools to deal with being exposed to these different things, like academic competitiveness or different things that are going on in the world and things that might show up on social media and what kids might be talking about. Like helping them manage those outside stressors is more effective than just trying to limit it, because they're going to leave your house and talk to people and hear these things potentially outside of the home. So giving them those tools is important.
I think also teaching them that it's okay to feel that way. I think oftentimes then kids come in and say, I don't want any anxiety, but anxiety is a normal human emotion. So we need some of it. Sometimes anxiety is a motivating factor that allows us to get to, where we need to be in life. If you have anxiety about, are we going to be successful? Then we may, do certain things to make sure that we'll be okay. Nothing can predict success, but there are things that can help with it. And sometimes so anxiety and that factor may be helpful. So I think sometimes parents lose sight of like, let's accept some of it. And so there's a concept called radical acceptance. If we can accept something as anxiety, then sometimes we'll be okay. Because I think that oftentimes I see patients often have fear. So it almost becomes they're anxious about being anxious. So I think acceptance is also key.
I think going off of that, I think that it's really important for, parents can't control the anxiety, their children's anxiety. But what Priscilla was saying is teaching children that it's okay to feel these emotions, validating opposed to minimizing, saying, it's okay that you feel this way, your emotions matter, your emotions deserve to take up space. Saying, no, you shouldn't feel this way, or it's a negative thing to feel anxiety. So I think it is really important to allow them to, while then also giving them skills so they can, self-soothe and manage it on their own.
Great points. Thank you so much. Amy, what's your next slide?
What are the warning signs that your child might be having an exacerbation of anxiety? As we mentioned earlier, so it's like a change in their ability to function where they may have been able to function before. Now, your child might have always been an anxious child. There might be just a continuum of them struggling in a certain area, but we always look at someone who was getting up and going to school without any sort of complaint, and all of a sudden they're struggling to be able to go there. Somebody who was performing well academically and now isn't completing papers or failing tests because they're not completing their tasks, like their grades are going down, their work ethic is going down. Social interactions changing drastically. Now, that doesn't always mean that the answer is anxiety. There could be a lot of things going on, but when we realize that something is of concern, it's usually popping up like something changed, something is not functioning the way that their child is not functioning the way that they had prior.
So for example, Amy and Priscilla and Julia, so if children's eating habits change, just for example, yes, or their temperament changes, would those be warning signs?
They could be. I think it's a reason to maybe, now again, we don't want to, somebody can have changes and it ends up not being anything, right? So here's the difference. Okay, so I'm thinking about parental anxiety. Then all of a sudden your kid's not eating and it's like, oh my God, they have anxiety. So that's the anxiousness of the parent, so that that's not necessarily the answer, but it's there's a change in their eating or there's a change in their sleeping. You meet that with a curiosity. Is there something else going on? Do I have the tools to figure out if there's something else going on? Do I need somebody else to look at it, which could be a medical professional, then a therapist, if nothing.
I usually also like to go to medical professional first because it could be a thyroid issue, there could be sugar level issues, there could be so many other things going on medically that could be inducing anxiety or even depression. So you're going to want to have that ruled out before you even go down the therapy route, because otherwise you could be mislabeling a child.
Mm-hmm. Yeah, there's so many things. It just could be.
Amy, we're coming up in about 45 minutes on the program. This is so informative. I'm learning a lot, and I thank you all. Again, for those listening and watching, please ask your questions, comment in the live stream for the panelists. Amy, I know you have one or two more slides. Mostly the slides have been up on screen. It would be great to have everyone all on screen in a conversation format so we can see you. Yeah, there you go. It's great to see everyone's smiling faces. You all look great on screen. So we were just talking about warning signs for our kids, right? And we talked as early 5-6-year-olds, right? And as children develop through time, let me ask you this. Can anxiety and stress, can they increase over as children get older and in different ways? For example, ADHD, I think, again, I'm a lay person, don't know much about the psychology of it, but other obsessive compulsive disorders. I mean, what can increased anxiety and stress for young children lead to as they grow into teens?
So ADHD is not an anxiety disorder, but OCD is.
Okay.
ADHD, if not addressed, can cause anxiety.
Okay.
Because if kids don't know what's going on with them and they can't function in certain ways that they think that they should be able to function in, that could cause anxiety and depression.
Okay.
But yes, anxiety not treated or addressed and a lack of awareness, it can grow. So for the example of OCD, right? Somebody can start off, OCD is obsessive compulsive disorder. So your brain obsesses over a specific thing. So a really run-of-the-mill one that people tend to know about is like washing your hands, right? So you get this thought that you need to wash your hands, you go and you wash your hands, the anxiety comes down really quickly, so then you feel like you're better. But then because you're doing that, you go from having to wash your hands twice a day to 3 times a day to 2 times an hour. And then all of a sudden you get trapped by it. So it does increase when you're doing that, what I said before, Mike, like that banging your head against the wall to get rid of a headache behavior, that makes the anxiety grow. When you're doing other things like therapeutic things, and then also in the moment skills to just kind of bring it down so you can apply therapy, then anxiety can at least be not that it goes away, because again, like we said, anxiety is emotion and everyone has that emotion, but it can become manageable.
Mm. You were talking about at home and the schools. We'll get more into that also. Be curious, are there different times of the day or week that can be increased anxiety?
I see a huge uptick on Sunday nights before school starts on Monday.
Right.
Most amount of phone calls I ever get, and ironically, it's my busiest day. But definitely Sunday night. Just commenting additionally on the disorders too. I see a lot of times in children that early on you might see like an avoidance from due to their anxiety, so they might avoid their dance classes early on, or like Hebrew school. And a parent might say, you know what, it's not worth the fight. We'll just kind of quit. And then what I've seen kind of down the road, like, and then I see a kid like a year later or something, after the anxiety was removed because they didn't have to do the thing. And then like you see it start maybe spilling over into schools. And then the kid is starting to refuse school. And so then the concern is, what does that exacerbate into? And so there's a diagnosis called agoraphobia. So that's fear of the marketplace, really kind of going out of the house or having social interaction with people. This is kind of like, I guess, the worst case scenario, right? Where they can't just leave the house at all. So there are other disorders like that as well that exist. But definitely Sunday night for me. What are your guys' thoughts? Same thing or different?
I was gonna, I was gonna touch upon the diagnosis too, because I just had a thought. I think that with anxiety, it tends to be, there's this component of comorbidity. And so it tends to be coupled with another diagnosis, and it doesn't necessarily need to be another anxiety diagnosis. So it can be, anxiety tends to be very, coupled with depression. And so if you can find the anxiety in children younger, they start to learn these skills, you can kind of prevent maybe some, of the coupling with other diagnoses. But yeah, I guess what times of days before school tends to be, I think Priscilla was saying Sunday nights. There's even like a term like Sunday scaries, where it's like, predicting the week and all the responsibilities and things that they have to do. So I think Sunday nights and then mornings before school.
Yeah, I definitely have clients who, like, if they can just, once they get past lunch, they feel much better. And also there's August. Teachers have this too. Like before the school year actually starts, before they actually get to see their teachers, there can be an uptick of anxiety. End of August for kids. It's not like in August, like teachers, it's August. Kids, it's like, a couple days before.
Yeah.
It's so interesting because you see such a decrease like before like spring break or, any type of winter break. And then, there's such a decrease in the anxiety. And then right before break, a few days before, like the night before, there's like that surge of anxiety again.
Mm-hmm.
I just looked up too, because I read an article, a while back, and I just want to make sure I didn't misspeak, but Emergency room visits are the highest on Monday mornings. Now it's the start of work week for most adults, so I wonder if there's some correlation. I have kind of read that there has been, but I'm sure there's other things too. But I just thought that was a little interesting tidbit for you guys.
Yeah.
Very
And
interesting.
it's not just anxiety across the board, but the time change when we get a lot, and that's probably more depressive than anxiety related, but we definitely get an increase of clients when like there are shorter days, and then they kind of start to, now that hopefully if the weather starts to pick up, then it's like there's a little bit more movement and happiness that goes along with that as well.
This is a terrific discussion. Again, thank you, the three of you. And again, for all those watching, please ask your questions, comment in the live stream, and our panelists will be happy in a Q&A toward the end. Let me ask you this. So you defined anxiety and stress, and we talked about in children and teens, and you talked about warning signs. Let's talk about solutions, right? What can we parents do at home? And also, what can our schools do? Of course, there's been quite a focus recently in our schools on mental health, which I think is very positive. Let's talk about at home. If we see some of these warning signs, Amy, Priscilla, Julia, what can we parents do?
So are you asking, Mike, about warning signs that somebody is anxious, or like your kid is in the middle of like an anxious state, like they are having currently anxiety, like a panic attack or an anxiety attack, or kind of a teenage tantruming, or like that kind of thing?
Yeah, good question. Both. If you see a change of behavior, parents see a change of behavior, or others, what can we do? Again, being a lay person, I think relaxation, right? Our behavior reflects on their behavior. But what other types of techniques, solutions can we do at home? I know you had that final slide, Amy. We're going to talk about a number of things.
Yeah, so I like to give the example of what anxiety is like. Have you ever like burnt something in your house, Mike, and the fire alarm goes off, and like your house thinks it's on fire, but it's not actually on fire? So the house thinks it's on fire. That's what anxiety is. It's actually our danger sensors are going off, that something's wrong. And if in that analogy, if your house is on fire and you go over to your fire alarm and you yell, "You're not on fire, you're not on fire," like the fire alarm is not going to go off, right? You have to do certain things to get the smoke out. Like you have to open the windows, you have to fan it, like that is what's going to essentially get the fire alarm to turn off, and for your house to know that you're not on fire. When we think we're in danger, when we're panicking, we are getting ready to it's like, the example that I love that was given is like, when we were cavemen, if there's like a tree outside of your cave and there's something behind the tree, it might be a rock and it might be a lion. When we were cavemen, we survived by thinking it was always a lion. In this day and age, we have now our prefrontal cortex. We can actually examine whether or not something is a danger or not, but anxiety throws you into panic mode. Everything's a lion. It's always a lion. And when we think it's a lion, our body physiologically does things for us to either freeze and pretend we're dead and hope that the lion walks away from us, fight the lion, or run away. So that's freeze, fight, flight. So one of the things that our body does is that our heart rate speeds up. So I always say this to my clients because it's a tool that is so easy to do that it's also really easy not to do. And when you're panicking, your brain tells you that it's not going to work, but it totally works. And that's like having a certain method of breathing that you enjoy that brings it down, so you can then say, "I'm not on fire. Is this a lion or is it a rock? Like, I'm good. Like, let me just look at this and see what's actually going on." So one breath that I do with my teens, I actually do with my kids, my younger kids too, is a 4-7-8 breath. It's one of my favorite breaths. So you breathe in for a count of 4, you hold it for a count of 7, and you breathe out for a count of 8. I use this breath all the time. I used it before we went live today. Like, I use it all the time. And then I think, Julia, you had another one that you do that's more visual with
Yeah,
your
so this one's more for like younger children, which is really great. But so it's called a mountain climber breathing. And so what you instruct them to do is that they are, hold up their hand and then they take their other finger, their pointer finger of their other hand. This is their mountain climber. And this is, the mountains that they're going to climb. And while they trace their finger up, they inhale, they pause because the mountain climber wants to take a picture at the top of the mountain, and then they exhale. So then they inhale, pause, hold your breath, exhale. And so you kind of go through it. You can also do it, depending on the situation, how emotionally distressed they are. They can do it, a second time or a third time. But most children really like that because, especially younger kids, right? So like 5-year-olds, 6-year-olds, they really kind of get that concept and they're really excited to do it.
Yeah, and there are two things that are happening. So you're slowing down your breath, but you're also getting very present with this. So with the counting, does 4, 7, 8 really, do those numbers really mean anything? No, but when you're concentrating on counting and on breathing, there are a couple different things that are happening. Another technique is called grounding. Priscilla mentioned it before, which also brings you very much in the present. So one way to do it is you look around the room and you say 5 things that you see. Then you do 4 things that you feel, not like I feel happy or whatever, but like I feel my foot on the bottom of my shoe. I feel my hair touching my cheek, that kind of feeling. So 4 things that you feel, 3 things that you hear. So you have to get real quiet and really present. That's my favorite one, the hearing one, and really find 3 things that are, so I hear like the air that's coming out of the vents. I hear the buzz from my computer. So then 2 things that you smell. That's a harder one. I tell my clients to actually like pick something up and smell it. Again, it's like getting into where you are and you're not spiraling in your thoughts. And 1 thing that you taste. So that's called grounding. It's another technique that you guys can use.
Makes sense. And I would think also activity, right? Physical activity. We all know, I would think that, correct me if I'm wrong, the same applies with children, right? They're usually much more active and so forth. But for us, if we work out, ride a bike, that seems to
all those key distractions. Yeah.
all those key distractions, and just there's something, right? The endorphins kind of calm and soothe. And I would think, getting to the schools and the activities for the kids, those non-academic, and the balance that you talked about earlier, Amy and Priscilla, right? The balance. That's why I would think kids who play sports or do extracurriculars, these can have positive effects.
I think as parents as well, we can kind of model behavior. So I often find that parents who have a household where they are expressing just all emotions in a positive way, like, yeah, I'm a little frustrated today. Oftentimes parents don't use these emotion words, but if they start using these emotion words more in their household in a calm manner, like I'm a little frustrated with this, whatever it may be, then you're modeling that behavior, that it's okay to have these emotions. And then it allows kids to talk about them before they maybe internalize so much and turn into negative core beliefs that then become exacerbated and stuff like that. So I think that good communication within a household and modeling that is helpful.
Such
I
a
think
key
also,
point. Go ahead,
Mike,
Amy. I was going to say, if we could say on that point just a second, Priscilla, I think that's such a key point for this program overall. And as we know, right, as you said, children model their parents' behavior. If we're anxious, maybe it can they become perhaps anxious, right? So much of what we do as parents, and look, we're stressed, we're anxious through the course of the day, but to maybe, it's not easier said than done, right? Regulate our emotions and the specific words that we choose to communicate with our kids. Do you want to all expand on that? I think it's such a key point. You described it so well, Priscilla. I don't know if Amy, I know I interrupted you, didn't mean to, and Julia, you talk a little bit more about that, parent modeling. And
yeah, I was gonna say, and I can fold it in too, but I think that okay, so you were mentioning the thing about exercising before, so I just want to touch on it and then fold it in. So there's not a thing, right? So we can say, oh, exercise helps, but then you can also have a situation where somebody needs something else, but they're being told, oh, you need to exercise, or they get it in their head that they need to exercise, and then that's not actually the tool that they need, right? Sometimes we need to exercise, sometimes we need a nap, sometimes we need a cookie, sometimes we need a shower, right? Sometimes we need to breathe or watch a comedy. Like, it's not always the same thing. So even when it comes to modeling with parents, it's that model too. Like, I'm feeling frustrated right now, so I'm going to go for a walk. I feel like I haven't really moved my body today, and I'm like needing it. Like, I'm kind of feel like my body's like itching, so I'm gonna go work out. But it's not like this. We live in a society. I think it's so lovely that we have access to all this self-help, but a lot of the self-help, because it's this one size fits all thing, it teaches you that if you do this thing, then you'll be happy all the time. We are not robots. We're not supposed to be happy all the time. It's not about doing the thing. Like, if you only eat this green juice, or if you exercise every day, or whatever it is, that you're going to be happy all the time. That is actually shutting us off from what our emotions are. What really wellness is being able to sit and think, what am I feeling and what do I need? And understanding that and getting deeper and deeper in understanding that, and then learning to do those things on your own to give yourself what you need. It's not, I get up every single day and run 3 miles. It's not that. And I think the more that parents learn to do that and teach their kids to do that, that's how we grow wellness.
Great
And I
point.
don't think that these coping skills are necessarily solutions, but they're, things that do help, in the moment. And so another thing is, I think, kind of going off of what Amy's saying, is this concept of self-care becomes very taboo. And it's very much, I'm going to do a face mask, and then then I'm going to feel better. But it's really checking in with yourself, and then also asking yourself, what is my future self going to be, is going to thank me for, right? Like, what am I going to do that it's going to help me in the future? And I think that's the mindset that we need to do. And at first, using these coping skills, you might do a breathing technique and be like, this doesn't help me, so nothing works. But then it's like, okay, but yeah, let me try intense exercise. Let me try changing my body temperature and holding ice, or taking a cold shower and checking in. And then once you really understand your coping skills, then you really understand your emotions and what you compare it to, and that emotional distress, just stressing or crisis that you're in. So it's really kind of learning about yourself, but it's not going to heal anything. I think that's where, therapy comes in, and you're really doing more of the work of understanding your triggers and what is actually, causing your anxiety.
As we mentioned earlier, we were talking about what parents can do, but also what can our schools do. Of course, it's been quite a focus, not just in Livingston, but throughout the country, right? Mental health, education and training, and our schools are taking initiatives, which is great to see. What are some of your thoughts on what our schools can be doing? I know there
Hire
are
more guidance counselors.
there are wellness rooms in
kidding.
many
I'm just
schools now.
kidding.
Yes, are there kind of meditation rooms? Of course, mindfulness is a big focus. Amy, you would know, yeah. What's
I think that the issue, need I say, I don't know, this is where kind of my own belief system comes in, but there's again, this kind of systemic go, 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 more, and then like breathe through it. The reality is that school is crazy stressful. And when you're talking about children and teens, there's so much more to school than just school. There's like the social stuff that they're figuring out. Why are kids not nice to me, even though I'm nice to them? Like, what is this social hierarchy that's going on? Like, why, they're figuring out, there's so much stress there. And on top of it, it's like, go, 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 perform, perform, perform. I don't know if like, it's good to, we're like teaching them how to navigate through that as part of it. And also just acknowledging like, there's something to look at there that, and I kind of was hoping a little bit that we would get there to some extent because we had to shut down. And I feel like we just kind of reset to where we were before, unfortunately.
Yeah.
I think the challenge too is that, schools really, they only focus on like 2 or 3 of the the intelligences. You know, Gardner has a theory about the 8 emotional intelligences. And school's only highlighting a few of those. I mean, some of them are things like artistic ability, right? And so, yeah, we might have art classes, but then most of it comes down to the letter grades in English and history and the things that the colleges nowadays are counting, because now they don't even count all your electives, is my understanding, is what some people are telling me. So I think that kids think they only can be good at this one thing, otherwise they're not good enough. And then it breeds more anxiety and then sometimes even depression. So I think it's about schools giving kids awareness even that like there is more than one thing. Because I think
Right.
that sight gets lost with that sometimes.
Yeah.
We also
And I-
deal in practice with a lot of what we call it, you might know, Mike, like fixed and growth mindset. So fixed mindset is I am pretty, I am smart, I am good at math, I am not good at math, right? That's fixed mindset. Growth mindset is if I work hard, like settle in, work hard, get better. And when we have a system where you're, graded, you are being judged by the person that is sitting in front of you, that's hard. How do you teach that? How do you really internalize when really you are being judged by your performance? So I don't have the answers of what this all should look like. Maybe 4 days a week instead of 5 would be nice.
Mm,
You know, one, I don't know, need like a little bit more where it's not every day they're kind of getting hammered with this stuff, like giving them a little bit of flexibility.
Yeah, I was
Please
talking to
don't get mad at me, Livingston moms, for me saying that. I'm sorry. Like, I don't know. Again, I don't have a solution that actually works with our society, but I'm just saying that it's, I can't tell you how many times I hear like, I have to do this 5 days a week and I can't even really refresh over the weekend. And then I have to go back and do it again. And this is my life. And I have to do this kind of like groundhog. And to hear that from children and teenagers is,
it's a tough world. Think back when we were in high school, right? We had that academic pressure and the social pressures, but now layer on top of that the 24/7 media world and social media being thrown. It's a tough environment for kids. So to your refresh, what you were just saying, Amy, and stepping away and relaxing, and all of these techniques, this has been so wonderful. I thank you all so much for your time and knowledge and expertise. We covered so many topics today, just beginning to scratch the surface. So if people wanted to contact you all, tell us how you all work together. Yes,
yes.
we do.
Priscilla, tell us.
So we do have a website. It's a simple website because the name of our company is Short Hills Counseling. And so it's just www.shorthillscounseling.com.
Okay.
All of our profiles are on there. And so obviously the phone number's on there too. And you can email us as well via that. So
You're close by to
yeah,
Livingston.
so we're right in Short Hills, near the mall in the Benihana that's in Short Hills on Morrison Drive.
And of course, Amy has extensive experience with the Livingston schools. Thank you all so much. Let's end, because we're a bit over an hour. Let's end with your sort of brief summary, each of you, words of wisdom that you might give to parents for the benefit of their kids. We touched on so many things. What comes to mind?
I got one.
Go for it.
I think the biggest complaint I get from the kids that I work with is when they're having an emotional thing going on, whether it's depression, anxiety, and they're telling their parent about it, their parents trying to give them all this advice. All the kid wants is for you to listen. They just want to vent. They actually don't want you to solve it. So don't solve the problem. Just listen. That's all they're looking for.
Great advice. Just to listen, be there for them. Julia, what do you think?
So I think I talked about this earlier, but I think validation is just so important. So validating their emotions, telling them that you hear them, you understand them, and then also just giving them time to, process the emotion, and not rush it. So I think that's something that's really important, just validation.
Terrific. And Amy, sum it up for us.
So as a parent, we have these 2 buckets to fill. And one of them is like guiding them to become independent, productive, and healthy adults. And the other one is this need that we all have as children and as adult children, is our child's need for like unconditional love. And the way that your child is interacting with you, if you take a second to reflect, you can tell if there's an imbalance. And sometimes we get really wrapped up in this one and we lose this one, which it kind of overlaps. Like sometimes we need to like put the stuff they have to do down and just kind of hang out with them and get like who they are and how cool they are and like just love them. And then it kind of evens it out. We need to do both, but this one is sometimes a miss.
So balance, yes. So listening to your word, Priscilla was saying listening, right? And Julia said validation, and Amy, balance. Words of wisdom from 3 mental health professionals. Thank you all so much. The 3 of you, greatly appreciate you being with us tonight. So we're going to sign off from now. And again, thanks so much for your time, your expertise, and your knowledge. Benefit for our community.
Thanks, Mike.
Thank you. Have a great evening.
Good night.
Bye.